Our next speaker is Dr. Magdalena Naylor. She's a professor in the Department of Psychiatry here at the University of Vermont. She's the director of the Mind-Body Medicine Clinic, as well as the director of the Clinical Neuroscience Research Unit. Magdalena is a very active member of the Neuroscience Behavior and Health Initiative, and she is involved in a number of really important studies, particularly around chronic pain and how to teach people through cognitive behavioral therapy, as well as through music and other means to reduce the pain level so as to reduce the amount of medication that people have to take. And so I'm very happy that she's here today to talk to us about mindfulness, because as she talked about mindfulness in the context of her patients, I thought this is actually really great because these things are directly applicable to how undergraduates and graduate students can deal with the level of stress that they're experiencing while they're here undergoing their training and education. So thank you very much, Magdalena, for coming to talk.
Thank you, Ray, for this kind introduction, and I'm very happy to be here. Dr. Hujak will be talking, having a lecture in 30 minutes, and he will be talking about the effects of mindfulness on brain function and structure. So I decided to talk about simply mindfulness and how you can actually apply this to decrease stress and suffering. Sometimes being a student or just being a human being and going through different environmental stressors, it might bring internal stress and suffering. So as a physician, I apply mindfulness to decrease pain and working with patients with post-traumatic stress disorder, depression, but I really believe that prevention is very important. So talking to young people, I am really, really pleased that I can give you some, for those who never practice or do not know much about mindfulness, what that is, and those who are practitioners, maybe this will help you to deepen your practice and make it easier for you. So, as you could see here, there's a picture of the Dr. Richie Davidson and Dalai Lama at the conference. Davidson, Kabat-Zinn, and others invited Dalai Lama about 15 years ago to collaborate on contemplative studies, some of them mostly meditation, and different types of contemplative studies, and work together and create a contemplative neuroscience. So what I put here that, meditation can improve scientists, but also scientists can improve meditation. And today I will be talking how, recent studies by my colleague Shinzen Yang actually made the mindfulness meditation a little bit easier. Those two are not real scientists, but if any of you know the program, it really caused a lot of stress and suffering. So we don't want to go there. So talking about scientists, what are the parallels between Buddhists and scientists? So the scientists analyze physical and mathematical structure into their basic parts, such as atoms, degree of freedom, etc. The goal is to understand how true and useful properties arise from interactions about those parts. From the Buddhist point of view, they analyze sensory experiences into their basic parts. Buddha created this diagram I will show you in a moment about 5 aggregates, 4 fundamentals, 4 elements. And the goal is understand how an illusory and painful property, such as self as a thing, arises from interactions among those parts. So those are these 5 aggregates by Buddha. The aggregates are form, feeling, concept, habit forces, and consciousness. And then we have how we can analyze it is external sense base, such as visible form, what we see, sounds, smells, touch, and taste, and also our mental objects. An internal sense base, our ears, our nose, our tongue, our body, those are the how we create and analyze those senses. The ultimate reality is those 28 material phenomena, 52 mental factors, and all of this creates consciousness. And if you practice this correctly, you will achieve nirvana. So going back to mindfulness, what's mindfulness? Mindfulness is a kind of non-elaborative, non-judgmental, present-centered awareness in which each thought, feeling, or sensation that arises in attentional field is acknowledged and accepted as it is. So mindfulness practice can be also described as a way of paying attention that originates in Eastern meditation practice. So there was Eastern practice, and we apply it to our Western life by paying attention in a particular way. And this is a way of on purpose, in the present moment, and non-judgmentally. In other way, bringing one's complete attention to the present experience on a moment-to-moment basis with curiosity, openness, and acceptance. So this is description what you do when you practice. But what I like about the mindfulness is that this that it has actually those 2 important aspects of it is practice and then informal mindfulness, which is application of mindful attention in everyday life. So actually what we say that mindfulness may be seen as a mode of being and can be practiced outside of formal settings. So you can actually practice it. Let's say you're sitting in the library and working on something and you are stressed about, say, okay, 1 minute of practice mindfulness. And I will tell you how you can do it very easily. And it could be 1 minute, 5 minutes, 10 minutes, 15 minutes. Patients with chronic pain, not chronic pain, patients with post-traumatic stress disorder, recent study done, those are patients with post-traumatic stress disorder from Iraq and soldiers from Iraq and Afghanistan. The severe post-traumatic stress disorder. The studies try to evaluate how long do those patients need to practice on daily basis in order to decrease their suffering and their symptoms. And what they find out that actually it's 12 to 15 minutes, but 12 minutes is the minimum. I always was telling my patients 10 minutes. Now I increase it to 12 minutes. But those were patients, those soldiers with severe post-traumatic stress disorder. You can designate 5 minutes a day, and you might actually see that by practice of 5 minutes a day may actually improve your awareness, your being in everyday life. So start with that, then go to 10 minutes, 15 minutes, then you might, as you will see later on, just practicing this actually give you some pleasure. So after a while you will say, hey, I'm gonna do it in 30 minutes because I feel good when I do it. So here it is as an example of a child exploring this, small creature, and she is paying attention to it. She uses her visual, the senses. They probably, if this creature is making noise, she hears, she smells. She's very concentrated on it. So we need to look at, on every moment of our life, what the mindfulness says, with this curiosity, with this openness, with something that we want to learn from every moment. So within mindfulness system, we talked about this awareness. What is mindful awareness? Mindful awareness is defined as having 3 attentional skills working together. And those skills are concentration power, sensory clarity, and equanimity. So again, those are 3 important skills. And those are the only 3 skills. It's a lot, but 3. What does that mean? It means that mindfulness is a collection of skills. And we like skills, and we know that a skill is an ability that can be improved with practice, yes? If you are playing an instrument or you are, let's say, playing basketball, at first you are throwing this basket and that ball to the basket, and you can, make one basket in 10 throws, and then after a while you will, so practice, and you improve. So most skills, like basketball playing, for example, involve some sort of external performance. But mindfulness skills are internal. So mindfulness skills are a way to process internally your sensory experience. So here it is this visual representation. So mindful awareness, there is an equanimity, sensory clarity, and concentration power. So what is concentration power? It is staying with what is relevant for you. This is ability to focus on what you consider to be relevant at a given time. Sensory clarity, it's like a brightness, high resolution, the ability to keep track of what you are actually experiencing in that moment. Not 5 things, just one thing at the moment, clearly. And equanimity is a kind of inner balance. The ability to allow sensory experience to come and go without push or pull. So I would like to give some examples of it. So this is the easiest way is to simply, evaluate, do I know what she's talking about? So let's explore certain situations. For example, you suddenly fell into a state of high focus. You were studying something and you just, you know what you're doing. Things slowed down, you were totally in groove, in the zone. Some people, who, for example, do, jogging. We know that people who jog, they go in the zone. Marathon runners, playing music, playing any instrument. People go they feel in the high concentration, and they feel this, they are in groove. As a result, you are able to respond with great effectiveness. If you are ever experienced anything like that, then you know what is a temporary state of concentration. But good thing is that with practice, you can develop this ability to get into that state anytime you want. You don't have to go and run for half an hour. You don't have to play instrument. You can actually do it every moment. Then another example, your senses suddenly became unusually bright and clearer. You could detect great detail and everything seems unusually vivid and rich. If you ever experience anything like this, then you know what a temporary state of high sensory clarity is. And again, good news, with practice, you can develop this ability to get into that state anytime you want. And the third example of equanimity, you are going through some physical, emotional, or mental discomfort. For some reason, you stop fighting with the discomfort and just let it flow through you. When you did that, the sense of problem or suffering became much less or perhaps totally vanished. If you ever experience anything like that, you know what the temporary state of equanimity is. And if you practice, you can develop that and you can go into that state anytime you want. I give you an example from my life. Just about a week ago, I was in my office, and then in the old buildings, our windows are such that we can open the window, but they just drop immediately unless you put something, to hold it. So I was opening the window. I have this office for years, and always think, be careful with your fingers. And then what happened? Of course, it dropped on my finger. The window is big like this. So I jerked it out, and of course my fingernail and part of my finger stayed under this window. So imagine my pain. I wanted to scream, but I look at the door is open. If I start screaming, everybody would catch. So I'm just, tears are going down my face, and I ran to my research assistant, take me to the ER. We are going to the ER, and this woman measures my blood pressure, and she just looks at me and says, "How much pain do you have on the scale from 0 to 10?" Answered it. So my research assistant says, "Why are you asking? Of course it's 10. And I look at her and said, "No, it's about maybe 4 to 5. And this nurse looks at me and says, "I cannot measure your blood pressure, it's so high. And you say your pain is 5? So as you could see, after this first shock, I just said, okay, equanimity. I didn't say that to myself, but I practiced meditation. I just went with the flow. I just experienced the pain. I went through the pain. I was non-judgmental. At first, I started to talk to myself saying, "Oh, you stupid, you did it, you dropped this on your finger." No, it's already done. And my pain, then I went to the doctor, and the doctor looks at me and says, "How much pain do you have on 0 to 10? I said, "Like about 2. And she looks at me and then poured on it, the iodine, and then it was 10 again. So if you answered yes to any of those above, you already have some understanding what I'm talking about, what it is to be mindful, and that quality of this mindfulness could improve the quality of your life. So the good news is that those are skills you can practice, and this training if you practice on a regular basis, it can spread on your everyday life. So there's this kind of 3 slogans: no self, no problem. When we consider ourselves, and I always tell my patients, we all consider ourselves like we are center of the universe. It's like we are so important. What somebody said. How somebody was treating us, but if you consider yourself that you are not a thing, you have no problem. No self, no problem. So if we start like a Buddhist, they analyze this and know myself, where I am, where I'm coming from, what I'm doing from moment to moment, there will be no problem. And again, flow self, no problem. Like when you have this fingernail. I came back to my office, I moved it up and took it, this finger was flat, fingernail, flat. So Shinzen Yang, who is a Buddhist master of Buddhist meditation, started, 30, 40 years ago as a Zen master. He created this simple model, which there are 3 modalities: visual, auditory, somatic, and 2 domains, inner and outer, which is the here we have this outside, which is see out, hear out, feel out. And then inside is see in, hear in, feel in. Those would be subjective. Those would be objective. Let's say objective because see out, it's when you are looking at me right now, that's see out. You hear me, hear out. You feel, for example, the chair under your legs, that will be feeling out. But then you also have see in, hear in, feel in. For example, you have an internal talk. You have, oh, this reminds me of that. This is your hear in. See in, if you close your eyes and maybe you remember some picture which reminds you of something like painful, like my experiences, would be see in. Feel in. When you were hearing about my experience, you might feel a little bit of anxiety, or so this would be this is your personal, internal, and those are external. So when you practice, you don't have to close your eyes. You can go, for example, on a walk in woods with your dog, and what you see, what you hear, it's a bird here singing, hear out. You see these beautiful leaves, see out. You smell, smell, that it would be feel out. Or you can consider it, it's feel out, feel out. Then how you feel, what is your internal talk, that would be hear in, see in, and feel in. So as you can see here, there are this visual, auditory, somatic, and grid, that the grid shows, and then there are the physical senses, and emotional, and thoughts, and then after a while you find out that actually it is not just one thing going through the other, but they are actually breaks, that you actually have this rest period. So you will see, wow, I don't think all the time, I don't feel all the time, I don't analyze everything. There will be rests. And after a while, those rests from 1 second will increase to 5 seconds, and then you will be able to have very long rests that actually you will feel this equanimity. So some critics of the meditation say that this is very personal and very selfish practice. People are not thinking about others. Which is actually not true, because if you are a better person, you will be also responding in a different way to other people. When I started practicing psychiatry, I was very proud of myself because my supervisor said that you have very high empathy level. So I was very proud of it. I am a very empathic person. And then I was working with patients with, post-traumatic stress disorder, with chronic pain and sexual and childhood abuse and other things. And I felt like my empathy is actually in my way. I feel, empathy is you are getting into other person's shoes. You feel what they feel. Oh, well, if you have one after another patients, you combine this, 5 patients, then I have feelings of 5 patients. So I was so stressed. And then when I started to practice meditation, I find out that there is a big difference between empathy and compassion. You don't have to actually feel what other people feel. You can be with them. So you are present. You are with them. Like here, and it is John Kabat-Zinn who started. 1993. There was this. Bill Moyers had a program on TV about mindfulness, and he was a star of that program. Kabat-Zinn, because he applied mindfulness into dealing with the chronic illness. And you could see here, he very compassionately dries somebody else's tears who suffers. And that's what it is. So if you are more with it, and you know who you are, and you become more compassionate for yourself, you also will be more compassionate for others. But again, you don't have to practice this by sitting on this special pillow with a special garment in a special position. You can practice mindfulness whatever you're doing dishes, doing your laundry, studying, and this will improve your quality of your life. So again, talking about those quality of the mindfulness, concentration is the power which allows a person to ignore the sensory challenge or to break it up into the manageable pieces. Moreover, there is a convincing evidence, which I mentioned before, that high concentration, concentrated states are intrinsically rewarding. So if you practice, you will want to practice. It's like those people who go and run, and on daily basis, 5 miles every day. If you tell them they cannot run, they have withdrawal symptoms. The same you will have. That's like, oh, this is so good. It feels good. The colloquial term for this phenomenon, as I said, is in the zone or being in flow state. Sensory clarity reduces person's perception of overwhelm by reducing flooding. So this is what I'm talking about, how we can reduce our suffering, yes? So it allows the person to experience exactly what is happening rather than what seems to be happening. Sometimes, when you look at other people, how they respond, it's like, no, it's not that. when you look at it from the outside, what is she or he talking about? Why is she suffering that much? It's not such a big deal. But what it is that when we touch, feel, image, and talk get tangled, they'll tend to multiply, creating an illusory emergent phenomena. Self is a thing. Sensory clarity takes a person from exponential overwhelm to linear manageability. So from the perception of touch, time, feel, time, image, time, talk, imagine to multiply that. It goes down to touch plus feel plus image plus talk. So it's significant. So when you divide it into and experience each of them separately, then you will feel less overwhelmed and you will have less suffering. So it is what is happening actually rather than what seems to be happening. And then equanimity is most easily understood by considering the opposite, which is resistance. Resistance to the flow of experience. Resistance is analogous to friction in a mechanical system. One part of the system is fighting against another, and then it creates energy and producing heat, which I call suffering. So increasing equanimity is analogous to lubricating one's sensory machinery. So here it is, this picture depicting, what mindfulness is. And as you could see, there are ears, there is nose, there is, a yoga pose, happy faces. So all of this is, but each of them is a separate thing. And that's what I would like to let you leave from this lecture, that don't feel overwhelmed. Try to experience each moment at a time, and you will feel happier. If you want resources, there are web resources, Basing Mindfulness Home Practice Program. You can also go to shinzen.org, and the web resources for further reading. And this is Shinzen Yang, my teacher and my collaborator in research, and he collaborates with us and collaborates at Harvard University and Yale. And really a guy who just enjoys life. So thank you very much, and if you have any questions. Is there time for questions? Or? We don't have time for questions, okay.